So thank you very much. I apologize I missed the beginning. My name's Nick Kman. I'm the director of the Med 4 year at Ohio State. And I know I met a lot of the ambassadors that are in the room. Just a quick reflection on my own experience. I echo a lot of what was said. I spend most of my time doing medical student teaching and advising, but I also do disaster medicine and disaster preparedness. So I work for FEMA. I deployed to Hurricane Harvey. I do some simulation and virtual reality for disasters and mass casualty incidents. So again, just another example of things that you can add to your career in emergency medicine and different niches that you can have. The next guest that we have, I'm really excited to introduce. Dr. Kathy Hiller is at the University of Arizona, and she's the incoming president of Clerkship Directors in Emergency Medicine, which is an academy of SAEM, and it's really a group of people that run clerkships and do medical student teaching really across the country. So I'm really proud to have her here. I'll also say that anyone that comes up here and presents, I think is willing to be available to you guys. You know, they're all very busy, but I think their names and email addresses we can make available to you. So let's give Dr. Hiller a round of applause. She's going to continue to talk about different options that you can pursue in emergency medicine. So this goes really well with the panel that we just had. Thanks, Kathy.
Thank you. Thanks so much, Nick, for that really kind introduction. So my name's Kathy Hiller. I'm from the University of Arizona. That's in Tucson, the original. We actually have a second University of Arizona Phoenix College of Medicine, which I'm fairly certain that Arizona State University is not super happy about, because that's the big rivalry in our state. And I was watching Nick pull up my slides from the back of the room and realized that I'm living an entire year behind. Not uncommon for me, unfortunately, but thank you for having me. Okay, so you've heard from a great, very experienced and thoughtful and wise panel about their choices and how they chose where to go for residency. And I will reiterate that not all EM residencies are created equal. So when you ask people what they're looking for in a residency, these are the sort of variables that people will discuss. They'll talk about location. Obviously, that's probably the most important thing. But you also have the option of choosing an academic residency versus a community residency, small versus large. Some programs are only 5, 6 residents per year. Some are 20-plus residents per year. Reputation is a very nebulous term that's hard to quantify and very subjective. But you can use RRC accreditation as sort of a surrogate for that. And I will tell you that almost all residencies are RRC accredited. We heard about 3 versus 4-year programs. And then some of you may actually be interested in combined residencies. So EM, IM, EM, PEDS, EM, FM. There's lots more options out there now. When you ask students what the #1 decision maker for where they chose to do their residency was, it was by far location. And this makes sense probably to all of you in the room who are about to launch this process. You really have to think about how your training is going to fit in with the rest of your life. But also, how does the location impact the educational experience you're going to get? I will tell you that our patient population in Tucson is very different than the patient population in Ohio or in Baltimore or in Seattle. There's not a whole lot of scorpion envenomations in Baltimore, and we don't see a whole lot of ciguatera in Tucson. So really thinking about what the catchment area is going to give you as far as your EM experience. Cost of living, I hope the recent engagement of the medical community on financial literacy has sort of sunk in with some of you, and really thinking about whether what the cost of living of the place that you're considering is. And then, are there options for a job in that area after you graduate? So I have been in Tucson since 2004, and I'll tell you that I was very lucky to get a job there when I did. there was basically no job market at that time. But now we're actually actively looking for people. So getting a sense from the prior residents, current residents even, of what the job market is after residency will help you decide whether that's someplace that you might want to settle in. Academic residencies are usually at a large tertiary care center. Frequently there are other residencies, so think about whether or not you might be competing for procedures, whether you're going to be handling that distal radius fracture on your own, or whether it's the orthopedics resident who's going to be reducing it. There are lots of other learners in the hospital, not just medical students, but nursing students, pharmacy students, et cetera. And then really the focus in academic residencies isn't academia. And so you're going to see a lot more and hear a lot more about scholarship, research, teaching, et cetera. County residencies tend to be high volume and high acuity. They frequently have less resources for kind of the newest and latest gadgets. There's usually a fairly intense trauma experience at county residencies, and it's a highly underserved population. Really great training in emergency medicine. Community residencies are extremely variable. Some of them can be that high volume, high acuity, low resource setting, but some of them can be very well funded and more sort of business model. So you can think about how you might get more experience or more training in the billing and coding and the finance aspect of medicine at a community medicine program like that. So size is a variable that is going to factor into your decision making. If you think about the small residencies, 6 residents per year, 18 total EM residents, versus a really large residency that could be upwards of 80 residents, you can also think about the needs of the faculty in those cases to support the residency. So you're going to be exposed to a lot more faculty at a large residency than at a small residency. I'll tell you, in Tucson we actually have 2 categorical emergency medicine residencies. One has 6 residents per year, the other has 16 residents per year. And they are very different fields. So anyone want to tell me what that rhythm is? It makes no sense, right? So this is kind of like talking about reputation. Really, it doesn't make a whole lot of sense. If you ask all of us up here, I'll give you different ideas of what we think the most competitive or the best residencies are. As long as they're RRC accredited, that's really the gold standard, and almost all residencies are RRC accredited. You've heard a lot about 3 versus 4 years. I will tell you my bias is I went to a 4-year residency, graduated from a 4-year residency, but I've been core faculty at a 3-year residency ever since. I will never forget when I was a PGY2 in my residency, my PGY4 chief said to me, "God, I wish I hadn't have done this. It's the $250,000 mistake." I don't agree with that. Like, I feel like I've got a very valuable education there. But depending on your own situation and how residency fits in with the rest of your life, you may not be able to take a 4th year. So really think about that when you think about where to apply. It turns out that about a third of all residencies are 4-year and about 2/3 are 3-year at this point. And also factoring into that decision is what you're planning on doing after residency. So if you're planning on for sure doing a fellowship in something afterwards, then think about how 4 years of residency plus however long it takes to do your fellowship, depending on what you're doing, will mean for the rest of your life. And then are there other priorities competing for time in your life? Is anyone interested in a combined residency? Awesome. So we also have a combined EM-PEDS residency in Tucson, and when I asked the program director for that residency what he said I should say to you all, because I didn't do combined training, he said, just have them call me. So the biggest piece of advice I can give you is if you're considering a combined residency, make sure you talk to a trusted mentor, and usually that's the program director or the APD at one of these programs.
If I could just add,
So I actually had a student match into that residency program, the EM-PEDS program. And one of the things that Dr. Hiller may touch on is make sure you have a good reason for doing this combined program. We talked a lot about you can do pediatric emergency medicine with a 3-year fellowship after doing emergency medicine, or you could do with a 2-year fellowship after doing emergency medicine. You can do pediatric emergency medicine with a 3-year fellowship after doing a pediatric residency. And so I said to him, why do you want to do a pediatrics residency and an emergency medicine residency? And he was an international student who wanted to practice both pediatrics and emergency medicine globally. And he wanted to have the skills of knowing the vaccination schedules, knowing well child checks, knowing how to do all those things, but also being able to take care of emergencies. And he matched into that program and really had thought out all his steps and his rationale for going to that program. So I just wanted to echo that. I think it's really important that you have a good thought process and why you would want to do a combined program.
Thank you, Nick. That was exactly my point, and we love him, by the way.
Thank you.
So if you don't have a clear plan as to why you would want to do both, that's okay too. The program directors for these programs would love to talk it through with you so they can really tell you why it's beneficial to have training in both and from their perspective what their graduates do. So if you're considering a combined program, the biggest piece of advice is really make sure you talk to someone who's actively involved in teaching or completed that program. That's all I've got for you. What questions do you have? I'm so sorry, I came in a little bit late, so I'm not sure who is even in the room. How many of you are M1, M2, M3, M4? Okay, great. So a lot of you have already matched and are looking forward to the next steps, and some of you are just getting ready to enter this process, and I'm sure there'll be a lot of peer-to-peer learning at the symposium as well. But if you have any questions for me at this point, I'd love to take them.
So just a quick plug too for there's very comprehensive advising documents through CORD, the Council of Residency Directors, and EMRA, the Emergency Medicine Resident Association. They put out a document that a lot of us within the specialty help contribute to. The document was just updated in January of this year, so I'll tweet that out, but you guys can Google it, and it has a lot of the things that our presenters are going to talk about. The one thing that I would maybe just add, Dr. Hiller, is I know our program's doing kind of a new push to what they're calling a 3+1 model. And what that is a 3-year residency training program with a lot of different fellowship options. So I can tell you guys, I really enjoyed my training at Wake Forest, and after the 3 years were over, I kind of was interested in staying there and doing more training. But the options that they had were peds and sports medicine, and those just for me weren't, what I wanted to do a fellowship in. But I think if they had EMS or disaster medicine or even education, I would have thought about doing a fellowship. So I know at our program we have an EMS fellowship, we have peds, we have ultrasound, we have administration, we have toxicology, and we have access to sports medicine. And I think one of the things that we sell medical students on is we have a 3-year training program, but we have a lot of different options for fellowship. So I think all 4 of our chief residents are doing fellowships, 3 of them at our institution and 1 in Wisconsin. So I would just mention that as kind of I'm seeing a new movement towards like a 3+1 kind of model in emergency medicine.
Yes, thank you for bringing that up. And actually, if you're not sure whether the institution that you're interested in has a fellowship option that you might be interested or not, SAEM has a comprehensive fellowship directory that is updated yearly about which institutions offer which fellowships. And that is something that you'll probably see more at academic institutions than you will at county or community programs. But if you know that you're interested in EMS or disaster, or you're kind of on the fence about a 3 versus 4 year and you think the 3 plus 1 model is the right way to go for you, then that's a really good thing to make sure you know about before you jump in.
Oh, looks like we have a question. No?
Hi, I'm Morgan from the University of Iowa, and I was curious for the combined emergency medicine, pediatrics specifically, but for any of the combined programs, how important is it to do an away rotation in, say, pediatric emergency medicine versus as a second away versus just doing the emergency medicine away?
So I can only speak for the one at our institution and only through a very narrow window. I will tell you that the applicants for our EM PEDS rotation are vetted as emergency applicants and as PEDS applicants. So they genuinely have to go through the match process twice. So just like any other EM applicant, you should do another EM rotation, not just PEDS EM. I don't know about whether a PEDS EM rotation specifically would add value or how much value it would add, and that's a really good question for a PEDS EM trained program director to answer.
Yeah, I'll just second that. We have an EM-IM program at Ohio State, and to apply to that program, we really strongly encourage applicants to have a second SLO from another institution, just like you would if you were applying to just categorical emergency medicine programs. The other thing I'll just say to that, and I don't know if this is different, you may know better, but when my student was applying to that combined EM PEDS program, I think there were only 5 or 6 of those in the country.
Yeah.
And so you're not going to only apply to 5 or 6 programs. So you're going to decide whether you want to apply to pediatric programs and those 5 programs or emergency medicine programs and those 5 programs. So you have to round out your application so you can be an applicant for those different programs as well. So it looks like, let's give Dr. Hiller a round of applause. Thank you for coming.